Ladies and gentlemen, given that my previous lecture in this series was on encrypted messaging, it's half tempting to start this one on lessons from the pandemic with an assessment of the former health minister's now very public WhatsApp messages. But this isn't a politics lecture, neither is it a political one, I promise. COVID-19 is still in our communities, and many of us are still coming to terms with its impact. So I have no intention of conducting an assessment of the effectiveness of the UK's or any other country's operational response. I am, you will be very pleased to hear, in no way qualified to do that. Rather, I'm going to focus on what the pandemic teaches us about how to communicate with the public on safety issues and how considering our safety online also as a public health concern might make us all safer and more secure. During the pandemic, public health messaging like this was an essential component of government's responses. And research has already been published that seeks to analyse this messaging, for example, from the perspective of communication science, in terms of self-reported levels of compliance, and with a particular interest in the use of social media. Now, systematic reviews are still ongoing, but we as individuals can testify that when asked to cover their faces, wash their hands, keep a distance from each other to protect themselves, their loved ones, and their communities, many people did this, and indeed, some still do. People all over the world proved that they were capable of taking preventative measures to control the spread of infection. And in the UK, public health messaging was reinforced with memorable slogans exhorting the public to action, including this one: stay home, protect the NHS, save lives, and the rather catchy hands, face, space. In lockdown in 2020, I wrote a book, as you do, on security rhetoric. The techniques used by governments, the media, and others to communicate safety and security to the public. And I was reminded of the similarity of the language and imagery of pandemics and that of cyber threats. More precisely, how the cybersecurity world routinely borrows from virology, immunology, and epidemiology to represent cyber threats as viruses and infections that spread. It set me thinking about why we had come to do that, what challenges that comparison might present, and whether there were opportunities to put it to better use. And I analysed 3 different types of communications. Government statements, such as those made by politicians and law enforcement agencies. The marketing materials of companies selling cybersecurity products, popularly known, of course, as antivirus software. And lastly, text written by cyber criminals themselves, such as phishing emails, scam messages, and pop-up ads. And what I found really surprised me. Governments, salespeople, and criminals all used similar techniques to catastrophize cyber threats, to make being a victim of cybercrime look and feel like the worst possible thing in the world. They did it for different reasons. Governments to justify what they were doing, and bizarrely in some cases were not doing, to tackle the problem. Companies to persuade people to buy their products, and criminals to entice or coerce people to comply with their demands. But they all portrayed digital technology as dark and anonymous, and cyber threats as colossal, deadly crises. And they all used mystifying technical jargon to do so. So I put myself in the shoes of someone looking for basic cybercrime prevention advice. And like many people would, I did a Google search. And because I was interested in all types of content, I searched for both text and images. And this is a screenshot of my search results in January 2020 for the search string cybercrime prevention. And you'll see that, perhaps with the exception of the advice sheet from the Philippines National Police towards the bottom left there of the screen, there seems to be something of a pattern. So let's take a closer look at this together. First of all, what colour is cybercrime prevention, would you say? Blue. Yep, absolutely. It appears to be either dark blue or, in fact, no colour at all, pitch black. Preventing cybercrime also appears to involve treating your computer like it's a crime scene, or at least putting a padlock on it. It requires an ability to code, use of some kind of futuristic projected touch technology, and pirates and insects crawling out of your computer screen. Faceless, hooded figures seem to be prominent as well, don't they? So before we go any further, let me ask you, how confident do you feel right now about your ability to protect yourself online? Because I will wager that unless you already work for law enforcement, for a cybersecurity company, or you're a cyber criminal, these images shout that cybersecurity is not for you. They say a picture paints 1,000 words, and this image sums up for me what the dominant rhetoric of cybersecurity has looked like for the last 30 years. It brings together several of the elements returned in my Google search: the blue light, the circuitry background, the cascading binary. They all speak of technical sophistication that is beyond the grasp of the average citizen. In fact, the central figure seems to be a sort of magician, conjuring up numbers from an ethereal keyboard, the like of which I've certainly never seen in real life. We're encouraged to assume, I think, that this is a male figure. He's wearing the stereotypical uniform of a hacker, the hoodie, and he's strangely faceless. His hands are accentuated. They're the only part of his body that are visible. They're grasping, rapacious even. They encourage us to think of him as a violent criminal, a mugger, or worse. But unlike the average mugger, the map behind him suggests that he is capable of reaching right around the world. Now, newsflash, in real life, not all cybercriminals wear hoodies. Some of them don't identify as male, and all of them certainly have faces. But somehow, we've ended up in a place where this is the accepted, even the default way of representing them, and in which the overwhelming impression is one of our own powerlessness, helplessness, and hopelessness. And when we look for precedents for this kind of image in popular culture, that sense of powerlessness is heightened because I suspect that when many people think of a hooded figure with grasping hands, they first think of this. And what we know about this chap, what we know about the Grim Reaper, is that barring a very few exceptions in European folk tales, when he comes for you, there's no escape. There is absolutely nothing you can do. So imagery that depicts cybercrime like this is hugely disempowering. It does nothing to make people safer beyond pushing them to buy a product. It has more to do with fiction and fantasy than with the reality of cybercrime. And yet, for several years, this very image was at the top of the welcome page on the FBI's website when ordinary people were searching for advice on cybercrime prevention. How on earth did we get here? The reasons were, I think, well-intentioned, but it got out of hand. Like many others working in cybersecurity, I have struggled to explain what on earth it is without reverting to metaphors. Language and imagery that make zeros, ones, and invisible data seem more immediate and more tangible. The persuasive impact of metaphors is in their ability to make someone feel as they might feel about the image invoked. So, for example, some parts of the web are represented as dark simply because they are not indexed by mainstream search engines and they're therefore less visible on the surface. Malicious software is described as infecting a computer because it enters the machine, it spreads, and it impairs its functioning. It behaves like a virus because it self-replicates, but it doesn't attack human bodies, or at least not yet. That's for another lecture. Even the word cybersecurity sounds remote from ordinary people's experience, like it's a made-up word from the pages of science fiction. And in fact, that's exactly what it is. Fantasy and science fiction are key features of what historians would perhaps call cybersecurity's foundation myth. The term cyberspace, which is now regularly used in international negotiations, was in fact coined by science fiction author William Gibson and popularized in his 1984 novel Neuromancer. And the subgenre in which Gibson was writing, cyberpunk, subsequently escaped the page to become a real-world aesthetic. All of these compound words with that cyber prefix, they trace their origins to cybernetics, the study of animal and mechanical regulatory systems expounded by Norbert Wiener in the 1940s. Now, Wiener's term itself borrowed from the ancient Greek kubernetes, meaning the helmsman or a steersman of a boat. Meanwhile, in the second half of the 20th century, popular science fiction abounded with cybernetic organisms, cyborgs. Darth Vader, Star Trek's Borg, Doctor Who's Cybermen, The Terminator, and my favourite, Battlestar Galactica's Cylons, all introduced cyborgs to the public well before something like cybersecurity gained currency as a popular concept. So all of these modern cyber words, of which the Oxford English Dictionary currently has 49, are confections. They're neologisms in which a prefix with its origins in ancient sailing is applied to digital technology. In contrast to the less exciting but probably more accurate alternative, network and information security, cybersecurity is difficult to grasp without an understanding of this somewhat obscure heritage. But in this respect, etymology reinforces the dominant rhetoric, which is that cybersecurity is exclusive, inaccessible, and dystopian. Cybersecurity's association with epidemiology also has its own history. It's commonly traced back to Gregory Benford's 1970 short story, The Scarred Man, in which malicious software had the name virus and the program engineered to remove it, vaccine. Benford had worked on the precursor to the internet, the US Department of Defense ARPANET project in the 1960s. So yet another intersection between life and art, between science fact and science fiction. But it's researcher Fred Cohen who is credited with introducing the term computer viruses to the academic world. And Cohen's definition was the blueprint not only for usage of that term, virus, but also of a wider transferred lexicon. In a 1987 article in the journal Computers and Security, he writes, "We define a computer virus as a program that can infect other programs by modifying them to include a possibly evolved copy of itself. With the infection property, a virus can spread throughout a computer system or network, using the authorizations of every user to infect their programs. Every program that gets infected may also act as a virus, and thus the infection grows." The hyperbolic potential of that metaphor is exploited from the outset. So Cohen expands. As an analogy to a computer virus, consider a biological disease that is 100% infectious, spreads whenever animals communicate, kills all infected animals instantly at a given moment, and has no detectable side effects until that moment. If a delay of even 1 week were between the introduction of the disease and its effect, it would be very likely to leave only a few remote villages alive and would certainly wipe out the vast majority of modern society. If a computer virus of this type could spread throughout the computers of the world, it would likely stop most computer use for a significant period of time and wreak havoc on modern government, financial, business, and academic institutions. That was back when academic institutions were important. Now, this language taps into our deep-seated fear of death and basic physiological needs, and its transferal to cybersecurity imbues computer problems with a sense of mortal danger. And one may think that engaging in that kind of alarmist rhetoric would have been something of a gamble during the COVID pandemic. Target audiences may legitimately have felt that they had bigger, more immediate threats to worry about. At the same time, you may remember something that I was struck by, that during the pandemic, many companies of all types sought to persuade us that we needed their products, quote unquote, more than ever. In late 2020, one cybersecurity vendor displayed this text on their website, and I really hope that I have sanitized this page as much as I need to, because as I often say when I show this slide, I really don't want to get sued. Preparing for the next global crisis, a cyber pandemic. People and organizations have suffered greatly from the coronavirus pandemic, that's true. Many critical lessons are being learned, but none more important than that another devastating crisis could be brewing. A catastrophic cyber event has long been envisioned, and with today's digitally connected world, a global cyber pandemic is now a reality. And a banner at the top of this page urged visitors to prepare for a cyber pandemic, secure your everything now. Now, there are a number of possible reactions to this content. It could indeed trigger the alarm at which it is evidently aimed. It could also be rejected as a cynical attempt to exploit an already heightened state of alert. It could likewise be seen as crass and insensitive by people who have been directly affected by COVID at the time. We can perhaps be more definite about what this messaging is not, and that is empowering for the citizen. In their communications on COVID, governments were keen to emphasise the active role of ordinary people in controlling the spread of the virus, in protecting themselves and others. In stark contrast here, the only solution is to purchase the product offered by the vendor. No further protective advice is given. On the same theme, companies started to promise cyber immunity while the world was in the throes of the first wave of coronavirus infections. This period also saw the launch of a product that claimed to be the world's first computer vaccine. Now, we don't have access to the sales figures of these companies before and after these campaigns, so it's not possible to gauge how successful these attempts to capitalise on the pandemic have been. But what is clear is that COVID-19 was used by some in the cybersecurity industry as a business opportunity and as a device to persuade potential customers of the urgency and severity of cyber threats. It's a clear example of a tactic that is known as FUD. F-U-D, fear, uncertainty, and doubt. Now, none of this critique should be taken as an attempt to dismiss cyber threats. Cyber attacks can be serious and damaging to reputations, finances, national security, and personal well-being. But there is no empirical evidence that scaring the hell out of people while making them feel powerless makes them any safer. If we think about it logically, there's no reason why it should. Highlighting the way in which certain types of imagery are consciously chosen and considering the potential impact of those on different audiences, particularly on a non-specialist, non-technical public, can help us to identify instead alternative framings that resonate with citizens, but also empower them to protect themselves and others. One proposed approach seeks to harness lessons learned from public health rather than simply exploiting its language and imagery. A social ecological model recognises that an individual's history and circumstances, their relationships, their community, and society at large all interact and all influence the occurrence of a problem and levels of protection from it. And there are precedents for applying this public health approach to safety and security issues. For instance, the World Health Organization includes violence prevention in its work as one of the social determinants, social, physical, and economic conditions that impact on health. In my research a few years ago on online child abuse, which I've included in the transcript for this lecture, considering risk and protective factors in this way helped me to appreciate the full range of interventions and stakeholders needed. And as you can see, there are quite a lot, which makes this map and the previous one rather complex to read at a distance. So I'm going to zoom out to the top level. Crucially, it demands that we give equal consideration to all types of intervention, regardless of our personal preferences and aversions. It tests our assumptions. It challenges our biases. For example, in order for children to be protected from sexual abuse online, it isn't simply enough to lock up offenders and make children and caregivers aware of the dangers. There also need to be services such as the Stop It Now helpline, which helps people who are concerned about their own thoughts or behaviour towards children, people who are worried about the behaviour of others, and friends and relatives of people who are arrested for child abuse. So a public health approach to the problem demands that we identify and provide also for underserved and hard-to-reach groups. This model is also eminently applicable to common cyber threats, and in the last decade or so, a number of researchers have proposed that we tackle communicable cyber threats as we do communicable diseases, and non-communicable cyber threats as we do non-communicable diseases. So let's consider for a few moments how that might work in practice. Botnets are networks of infected devices that are then used to conduct attacks on other devices, on systems and on networks. And if you use social media, you'll also be familiar with the fact that people's accounts can be hacked or cloned in order to dupe or scam one's friend networks. Equally, fake news spreads via sharing on social media. In fact, we often say that it goes viral. So all of these behave in a way that is similar to communicable diseases. Cyber threats that aren't directly spread to others behave like non-communicable diseases. And in this category, we might include attacks on websites that disrupt delivery of a service, denial of service attacks, scams designed to take your money, and ransomware attacks that lock devices until a ransom is paid. A public health approach also seeks to address individuals' risk behaviours and environmental exposures. And for our purposes, these could include sharing account passwords with other people. That's something you really shouldn't do. Not installing antivirus software. Clicking on unchecked links, all of which can be reduced through behavioural change and awareness. And finally, there are risks that simply come with the environment. For example, using public Wi-Fi, having to share devices with other people, being exposed to information online that may or may not be true, and entrusting personal data to retailers and other online service providers, all of which can be mitigated to some degree. So breaking it down in this way helps us to identify opportunities for prevention and intervention. Communicable cyber threats, such as unwittingly being the intermediary for an attack as part of a botnet, can be met with system-level interventions, including quarantine of infected devices, mandatory reporting of new cases, educational information and guidelines for early detection. But it also means that we can prioritise various forms of prevention. Primary prevention, to minimise the threat by addressing risk behaviours and promoting generalised protections. Secondary prevention, to reduce the impact of a disease or incident through targeted intervention. And tertiary prevention, to manage long-term effects and reduce the risk of recurrence. And we can also promote cyber hygiene at an individual level. So let's take a practical example. A device can become part of a botnet when the user clicks on malicious software. And this could have arrived in an attachment or an email or a web link of some description. That malware infects the device, in this case, hijacking the processing power to disable websites by flooding them with traffic. We see similar process flows in other types of cybercrime as well, like someone compromising your email or social media account and using it to send scam messages to your contacts. Now, naturally, the first hope is that we can prevent this entirely. Not downloading the software in the first place is the surest way to prevent the device being infected and used in attacks. But if we're not able to do that, there are other points at which we can intervene to reduce the impact. For instance, if your device has antivirus protection, even if you click on a suspicious link or an attachment, it can be detected and removed before it can do any further damage. And even if you have failed in your duty to protect yourself and others, we can still help those others with their defences. Considering cybersecurity as a public health issue also helps us to identify what needs to improve at a societal level. And this public health approach typically comprises 4 main steps. Firstly, we define and monitor the problem. Then, we identify those risk and protective factors. Next, we develop and test prevention strategies. And finally, we assure that there is widespread adoption. As the first step suggests, reliable data on the scale and nature of a problem is essential to determining the correct responses, and it ensures that there is an evidence base for any measures that are developed and adopted. Just as COVID cases, hospitalisation rates, and excess deaths were continuously reported at the height of the pandemic, so too we need to know how big, how prevalent a particular cyber problem is. But this is easier said than done because the data on cyber threats is so disparate. Law enforcement has data on reported crimes. Technology providers have access to reports from their users. Organisations of all sorts have logs of suspicious activity on their networks. Antivirus companies have data from scans of their customers' devices, and so on and so forth. European legislation, in the form of GDPR, mandates reporting of data breaches to national authorities. But governments very often find that they have to rely on estimates based on surveys with some fairly small sample sizes. For instance, the Crime Survey for England and Wales estimates that 1.6 million incidents of computer misuse, as defined in national legislation, in the year to March 2022. But this was based on a sample of just 13,500 households. And the UK government's Cybersecurity Breaches Survey estimates that 39% of businesses identified that they had suffered a cyber attack in 2022, based on a sample of just 1,244 businesses. Now, there's nothing wrong with these numbers. They are definitely very helpful indicators, but they are incomplete data on which to base national responses and to spend national resources. We need the data on cyber threats to be much more systematic and comprehensive in order for us to be able to decide whether we really do have a cyber pandemic or whether that is just marketing hype. So we could do with a public health approach to data collection, perhaps even, dare I say, a World Cyber Health Organization to do this. A public health approach to cybersecurity could also legitimately adopt the language and imagery of community disease control, while at the same time giving agency to citizens. Public health communications need to be easily understood. So the fear, the uncertainty, and the doubt of cybersecurity must go, as must the overuse of technical jargon, which we will unpack further in the next lecture. If we want target populations to take some kind of action and even change their behaviour, we need to communicate clearly what they should do and ensure that these actions are convenient and attractive. Incidentally, these are the results Google returned when I searched for images of public health last week. And I think it's fair to say that they are a lot more inclusive and accessible than those for cybercrime prevention. We have rainbow colours. We have non-threatening representations of people with faces. At the height of the COVID pandemic, members of the public were not expected to have an advanced understanding of virology, of immunology, or of epidemiology, but we were expected to understand that hygiene and distancing measures help to control the spread of infection. In the US, the UK, and in Commonwealth countries, generations of people became familiar with this concept through the slogan, "Coughs and sneezes spread diseases." And while for some, the encouragement to use a handkerchief may smack of the nanny state, this phrase is so memorable that the World Health Organization still uses it in its video content. A light-hearted approach to disease control is perfectly acceptable, but humour is very rarely deployed in public information on cyber threats. One notable exception is Disney's Ralph Breaks the Internet. It's an animated comedy from 2018 that firmly targets a family audience. I've deliberately left this slide blank so that it will be all the easier for you to imagine as I describe the scene, but also because Disney has a fairly robust and formidable process for requesting use of its content for educational purposes. The main characters are two friends, Wreck-It Ralph and Vanellope von Schweetz, and they are characters in video games in an amusement arcade. And they physically enter the internet via a Wi-Fi router, or router if you're listening outside the UK. Online platforms in the internet are depicted as physical locations, and algorithms are physical creatures. And that overall presentation is very accessible and very non-threatening. One of the characters is a pop-up advertiser, and his name is J.B. Spamley. And he guides Ralph into the darknet to source a virus that will slow down a racing game with which Vanellope has become absolutely obsessed. The aim is to make the game so boring that she will want to leave and go home. So Ralph and Spamley, they descend in a lift to the darknet, which is, of course, a kind of underworld. It's a dank, dimly lit, green-tinged rather than blue-tinged street, which houses the premises of Double Dan. Dan is a man-sized slug, with more than a passing resemblance to Star Wars' Jabba the Hutt and the voice of a Cockney gangster, or rather Russell Brand's version of a Cockney gangster. It's a scene that's reminiscent of Monty Python's Dead Parrot sketch or the purchase of the Mogwai in Gremlins. The darknet is essentially transformed into an exotic pet shop. The virus for sale bursts out of its cage, and he is a mechanical, serpent-like monster twisting and turning. And his name is Arthur. Now, Arthur is by no means a cute pet, and his sudden explosion from his confines is surely intended to make a younger audience jump out of their seats. He's clearly quite dangerous, but that comic setting, the informal dialogue, and the cartoonish rendering recast cyber threats as intelligible to mass audiences. And as portrayals of my subject go, this is one of the most inclusive and engaging. Now, its impact on the next generation of the world's adults remains to be seen, but it nevertheless illustrates that a more light-hearted approach to cyber threats is possible. And in fact, there is research to suggest that images with positive emotional impact are more likely to be remembered, especially by older adults. So a cyber-positive approach could actually be more effective. Now, it's all very well my standing here and diagnosing the problem. That is what I most like to do in this world. But what we really need now are solutions. And here too, public health can serve as our guide. And here is my personal inspiration for what I think we need to produce.
You may have met a few people who like doing this sort of thing. They're a nuisance, I agree, but pretty harmless. You have certainly seen thousands like this. They're not a nuisance. They're a real danger. Right, stop it, you. Stop it. Stop it. Come here. What do you think you're up to? You've probably infected thousands of people already. What do you think this is for? Yes, that's all right, but here's another way of using your handkerchief. Now sneeze. Come on. All right, never mind. Close your eyes. Now, handkerchief. Sneeze. Sneeze, handkerchief. Got it? Fine. Understand? Handkerchief, sneeze. See what I mean? That's the idea. Fine. Now you can carry on.
It gets me every time, that. So I've seen it hundreds and hundreds of times. The infectiously, pardon the pun, joyful genius of Richard Massingham at work there with his 1945 public information film entitled Coughs and Sneezes. And I am beyond excited to share with you that at Gresham we have set ourselves the task of producing public information films on online safety that hits that spot. They're not quite ready yet, in case you were as excited as I am. But they will be in the next few weeks, and we will be sharing them far and wide on our website, on our social channels, and they will feature in my next lecture, Cybersecurity for Humans, on the 9th of May. So that is my call to action. For people like me and institutions like this one, to do a better job of showing you what you can do, not just what you mustn't. To promote cyber hygiene, to perhaps encourage people to practice safe cyber. Perhaps even keep our communities cyber clean and tidy. It certainly sounds more achievable and empowering than messaging in which cybercrime is catastrophic, demonic, inescapable, and unintelligible. The COVID-19 pandemic showed that many people are capable of taking measures to protect themselves and their communities. So why don't we entrust them to do the same with cybersecurity? We've tried fear, uncertainty and doubt for the last 3 decades, and it doesn't seem to have worked. We stand a better chance of defeating digital viruses if we act as a community. So let's harness the lessons of the last few years to improve our cyber health. In fact, it's not even cyber, is it? It's just health. It's just safety. And we, you, know how to do that. So, I expect to see you all back here, and you at home, on the 9th of May, so that you can receive your orders. Thank you very much.
Thank you so much, Professor Baines, for the fascinating lecture. I've got some questions from online and then hopefully some in the room as well. First one from online. Is it possible to design an operating system that protects against viruses?
Oh, goodness. So, speaking from past experience, where I worked for a large technology company, one of whose motivational slogans used to be move fast and break things, but is now just move fast. One of the challenges we have in technology is that we want to ship stuff out really, really quickly. So apologies to the person at home. I'm not going to talk exclusively about operating systems, but certainly in the world of software, we want to get it out quickly so that it can hit the market as soon as possible because it needs to make money. Over the last 10 years, I would say, there's been more of a focus on security by design. And one of my jobs in big tech, actually, from a safety perspective, was every time a new product was being developed to come in and say, actually, have you thought about the safety of young people? Have you thought about X, Y, and Z? And to actually spend that time tweaking products before they hit the market. Now, that's a great way of doing it. Another way of doing it is to make sure that there are security patches available for software. And I would say that reducing risk behaviors that we had on the table there, another one is making sure that your software is up to date. So Microsoft is famous for this. They have patches coming out every week, updating their software to minimize security vulnerabilities. If you have a smartphone, you will see that Apple and Samsung, or Apple and Android, will be constantly pushing you to install security updates. Please do that, because they're finding the bugs. They've also got kind of people out in the wider world finding the bugs, reporting them to them through bug bounty programs. So every time you update your software, you are safer. So is it possible? I've not seen a 100% secure operating system. I doubt that that exists. But the more that we can build security by design into any tech that we develop, then the lower the risk at the start.
I've got another one from online before going to the room, if that's all right. Is there anyone in cybersecurity who does public information well?
Yes, I think so. So, yes, I gave you a very negative picture of the cybersecurity industry. Obviously, I'm not going to do product placement or endorsement, so I'm not going to name this company. But if you're in the UK at home, and certainly people in the room, if you watch TV, you might have seen some TV adverts for an antivirus software company. And what they do is they stage cybersecurity problems almost like a mental health intervention. So they have a room of people challenging the technology and saying, I received an image and I didn't want to receive that. And it's actually an older lady, which is why it's meant to be funny. Sorry, older ladies. As an older lady myself, I don't think it's that funny that people get intimate images, but there you go. But yes, that's one example. Another one, is a victim of ransomware and says, somebody's just asked me for Bitcoin, and somebody else says, Bitcoin? What is Bitcoin? So it's demystifying all of that. It's not making it blue lights. It's not making it cascading zeros and ones. It's not faceless muggers in hoodies. It's taking it down to, how would we actually approach this if this was a problematic person? Well, we'd take them to one side and we'd say, hey, your behavior is really out of order. We need to make you safer and more secure. So anything like that that makes it more immediate without just piling on the fear.
One of the things that strikes me is there's no national approach to this. And I'm old enough to remember that no can't click every trick. The seatbelt thing, so where's the don't click every link one or something like that? I mean, is there anything that you're aware of that's coming through like that?
Yes, we're making it. Now, what I think is really challenging, because I've had to get my head around this, is slogans. Yeah, it's really, really challenging because, the minute you talk about the language of cybersecurity, you may have noticed when I put botnets up on the screen, I was very careful every time I mentioned botnets to explain exactly what that was, because I recognise that that's a made-up word as well. Cybersecurity and cybercrime is full of these portmanteau words where you get one word, you squash it onto another word. Acronyms. So you know, every time we think about Trojans, we say, oh, well, that's rats. The Trojans are full of rats. And you think, what language are you talking? Well, you know, Trojans are programs that get into your system and then, like a Trojan horse, sit there for a while and then do what they need to do. And a rat is a remote access Trojan. And the reason I mention that, Pat, is that every time you think of, well, what are we asking people to do here? Can we put it into 3 words? It's really, really difficult with cybersecurity to put it into 3 words because the vocabulary is so technical. So you will see in the coming weeks that what we've done is we've taken a slightly different approach, which is really looking at it from the kind of cyber coughs and sneezes perspective, keeping IT clean and safe and secure, rather than putting the focus on cyber. And just as an aside, if I may, some of the really good educational programs that I've seen, or some of the best ones that I've seen, have not been about treating cybersecurity as a separate thing. So, in case you're interested, Age Concern do a fantastic program. It's called Get Comfortable Online, which is exactly what you want people to be. You don't want people to be terrified, particularly older members of the community that might not be digital natives, as we call them. The Women's Institute is fantastic. The Women's Institute trains ambassadors in the Women's Institute to train other members of the Women's Institute. So they're getting IT upskilling and online safety and online security information from peers that they trust, rather than people who are out to not intentionally bamboozle them, but whose default is to use technical jargon, the fantasy language of cyber.
I think there's one at the back.
Yes.
Yeah, good evening. Thank you very much for the insights and the encouragement and the achievements you have done so far. My colleague there, my senior colleague, mentioned about standard. They are pushing everybody into the IT knowledge-based things. But they are not, as much as you are working for the cybersecurity, they are not curbing. They are increasing people, they are doing things to be online.
Yeah.
But the more we are online, the more the fraud is increasing.
Okay.
So what are you doing to reduce it or avert it? Thank you.
Yeah. So, if you don't mind, am I all right to go back? Right. So this is on online child abuse and online child safety. But what you see with anything like fraud, with anything that happens online, and as I discussed to a certain extent in my first lecture on who owns the internet at the back end of last year, is really that you need a whole society response. So you're absolutely right. If companies are developing software, if they're developing products that are digital, they absolutely have a responsibility to make sure that those products are as safe and secure as they possibly can be. But they're not the only people to combat fraud in society. So you still need well-resourced law enforcement. You need enough police officers. You need police officers who understand fintech, for instance, and all the products that are coming out. You need everybody to understand that environment. You need legislation to be up to speed with how crimes are being committed in the real world. You need policymakers, you need politicians who understand the technology as well. You need the media to be reporting on it responsibly. So again, I didn't mention the media very much in this talk, but the media are very fond of scaring the hell out of people when it comes to cybercrime. You'll be unsurprised to hear. You need academics, you need people like me to actually be researching and using the data, collecting the data, tracking, changing trends on how crimes are being committed. And importantly, you need that human awareness, you need that education for society at large. So while this map isn't specifically about fraud, as you asked, I think every single issue that relates to online safety and security has to be a whole society response, and that's one of the reasons why I think this public health framework could be a real winner.
Could I take one more question for you from the online audience? The question is, are there any public health campaigns that have not worked so well?
Yes. So I painted a very rosy picture of public health campaigns, and I think that's because, to a certain extent, the UK government and other countries around the World Health Organization, they've had time to get this right, and they've had time to make mistakes. I was a child in 1987 when the AIDS Don't Die of Ignorance campaign came out in the UK. And I understand that in lots of other countries, there were very hard-hitting campaigns. So for those of you who might not remember that, that involved, it wasn't Ridley Scott, but it was Nick Rogue, the famous film director, directing an ad in which John Hurt did the voiceover, and it was all very sinister, it was all very dark, and there was a huge tombstone that had AIDS, and then some lilies. Now, as a child, I thought that was absolutely terrifying. And I think that was deliberate by the Thatcher government, and the minister in charge saw it as a success and still sees it as a success. However, there has been research since, and I can see exactly where this research is coming from, suggesting that if you already had HIV or AIDS, that campaign was hugely demonizing and exclusionary. So thinking about public health as that whole society approach, but also serving everybody in society, not just, the bulk of people through a TV campaign. But I believe that lessons have been learned since then. So that would be my negative exemplum that is still seen as hugely positive in some circles. So.
We only have about 1 minute to go, so I'm very cheekily going to offer you this question from online as well, because it's short. Do you foresee any difficulties about a World Cyber Health Organization collecting data?
Yes. Even though I suggested it, the thing about public health, the thing about COVID numbers, is that by and large, countries weren't infecting each other with COVID. Now, you can argue the toss of that as to who let it spread, et cetera, et cetera. The trouble with cybercrime is that we have nation-state activity and state-sponsored activity. So at the moment, the UN is trying to come to an international cybercrime convention, and this is one of the sticking points, is that countries do cybercrime to each other. So collecting data is more problematic when it becomes an issue of national security like that. It doesn't mean we shouldn't try it. It just means it's not quite as, I wouldn't say simple, a coalition of the willing as it might be on public health.
Thank you so much, Professor Baines, and thank you to our audience in the room and our audience online. And please come back for Professor Baines' next lecture on Tuesday the 9th of May. Thank you so much.
Thank you.